Did the governor's order protect nursing homes from being sued by families who lost loved ones to the virus? NBC5 investigates. Now, NBC5 investigates more than half of Illinois residents who have died from coronavirus complications lived at long-term care facilities.
And many families, they say they want justice for their loved ones. They now face more heartache. An order from the governor, they say, that protects nursing homes and not those who lived inside. Here's Katie Kim.
Was the hardest part for me is that she died alone.
Michelle Angadi can't seem to shake her grief. Her mom, Mary, was a resident at Bria of Palos Hills Nursing Home. She died in April from coronavirus complications.
It's the worst thing that I have ever had to deal with in my life is losing my mom and watching her die on a phone.
Michelle regrets not getting her mom out of the facility sooner. She says she complained of poor, filthy conditions even before the pandemic.
3 patients in a room the size of a small living room.
Bria of Palos Hills says its infectious disease prevention protocols exceeded the CDC guidelines and that staff works tirelessly to prevent the spread of COVID-19 and save lives. But Michelle believes neglect at the facility contributed to her mom's death and is considering legal action.
But families like Michelle's face an uphill battle in court. Governor J.B. Pritzker issued an executive order in early April that provides liability protection to healthcare facilities, including nursing homes.
It gives them immunity, except for cases of gross negligence or willful misconduct.
I think that's wrong. I think that's ridiculous.
Families deserve answers. Families deserve to know what happened with their loved ones.
Patient advocates and attorneys blasted the order for being too broad and for protecting an industry they describe as having a long history of issues.
They simply did not have the right staff, the right supplies, the right training, and the right infection control procedures to deal with ordinary communicable diseases, let alone the pandemic.
Critics also question who had a voice in crafting the order. Northwestern University professor Jacqueline Stevens requested the governor's administration's correspondence under the Freedom of Information Act. She says documents show input from hospital CEOs and lobbyists, but not patient advocates.
It was very clear who was being consulted and who was being left out.
The governor's office would only say it discussed the matter with people internally and externally. A spokesperson continued saying the executive orders do not prevent lawsuits against nursing homes and would not provide liability protections to those that fail to take steps to treat and prevent the spread of COVID-19. As for industry representatives, they say immunity was necessary to focus on critical care instead of worrying about legal consequences.
The nursing homes are our first responders, just as the rest of the healthcare system is. And the targeted actions against nursing homes and the anger towards nursing homes is not being replicated with our other healthcare partners.
This executive order is set to expire on June 27th. The governor's office says it's still discussing whether to extend it. Katie Kim, NBC5 investigates.
Our thanks to Katie.